BMI, best medical information, or maybe best body act. Well, let's find out what BMI actually stands for. BMI and health. I like that concept of health. I think that's supposed to be, best medical information, or maybe it's best something or other, or maybe it's just body mass index. Let's find out what they're going to be talking about today. Let's find out.
Perfect. So, Nirma, if you want to switch to the next slide, I just wanted to introduce a few things before we get started. Of course, we know the holiday season is coming up, and in the season of giving and the season of gratitude, we first wanted to share a beautiful piece of artwork that one of our volunteers was able to create not too long ago. As you can see right here, one of our volunteers, her name is Dong, put together this beautiful piece of art, and I always really like it because, of course, you can see the heart, but as you look more and more, you see a lot more in this picture. And I took some screenshots for you to be able to see some of the different features of this heart. Of course, you can see in the top left here generations of young and older. You can see medications. Of course, down here you can see the world, Dr. Curnew's book. Of course, as we know, we're in a global pandemic, and we're doing everything we can to stay safe and healthy throughout the past few years. And it's not just affecting us, of course, it's affecting everyone around the world. So thinking about how our actions have repercussions on not just ourselves, but other people as well, is a lovely message that I take away from this painting. Of course, you can see our fruits and vegetables in the top right. And then down on the bottom right, you can see some happy individuals. So you can see someone embracing someone else. Of course, we know the importance of having strong social connections. And you can see the Chinook stairs, which Dr. Curnew enjoys taking every once in a while as well to get his exercise after the clinic. So this is what we see in this painting, but of course we wanted you to just take a moment to think about what you're grateful for, what you see in this painting, and maybe what your takeaways are. Dr. Curnew, did
So
you want to share anything?
yeah, what I see is, first of all, I want to thank Dong. She's just an amazing young lady who is already changing the world at such a young age, and she will continue to do so. As many of these McMaster students have been, and we're very grateful. So, if you see on the left the baby and then the grandma together, reminds me a couple stories. As we get older, we get wrinkles of the skin. As we get older, our vessels get wrinkly, and we develop heart disease. And a question always is asked: when does heart disease start? It starts at the day you're born. Um, and here's a story: is that between grandma and grandchild is that one of the things when I grew up, I got ear infections, and so I got my tonsils taken out. But what was getting is pneumococcal infections, and that's actually being prevented by vaccination. And by children getting vaccinated today against pneumococcal pneumonia, what happens? They use Prevnar 13. They prevent ear infections, so you don't have to have tonsil surgery anymore, which is a procedure that's almost gone. But more importantly, is by getting vaccinated early in life, you stop transmission of pneumococcus from your nose into your grandparents, so they have less pneumonia and they don't die as much. So you can see the transmission of diseases, and we learned right now is that we're living through pandemics. One of the pandemics before was the Spanish flu that we know so much about. You can see how contagious some of these viruses are, and so think about how to protect yourselves. And you can see on the top there are some pills. Now, people think pills are bad. I think of cholesterol pills as being protective for the heart. What I see on the bottom right is happy people. People tell me that they're too sore, they're too tired, they don't have enough time to climb the stairs. You know what? When you lose the ability to be mobile, it's time to think about checking into nursing home. And so keeping active and activity is a great way of being active. You can see that heart in the middle. And I hope people enjoy our book. And one of the things, that book is a work of hundreds of people over 25 years, and all the proceeds go to help others. So I feel really privileged to do that. And you can see what's the best way of getting vitamin C. Should be a pill ball? No, should be from fruits and vegetables, and that should be the backbone of therapy. So, and your health. So I see so much in this, and so I hope people think about this and reflect on how to make their heart pump better, last longer, and how to be a sense of community. And so I'm very grateful for so many things. And one of the things I'm grateful for this painting, and I have a chance to just look at it sitting on my sofa right now. I'll be in the waiting room beforehand. So I hope it brings messages to others that you can do things to be healthier. And one of the things is keeping your weight down, body mass index, is that's what we're going to be talking about today. It's one of those things that many of us don't pay enough attention thinking about. Does that mean anything else to anybody else? Well, we'll talk more about that. Let's go to the next slide. I don't want to make this, I want people to lots to think about.
Yeah, so on this slide, Dr. Curnew, you mentioned a lot of the key elements that we also discussed in this video. I wanted to ask you if you wanted us to play this video, or would you like us to show it another time and we continued our discussion on the next slide?
Yeah, why don't we just show another time, because
Sure.
we'll post that at another date right now.
Sounds good. So Nurme, if you are able to transition over to the next slide, there's a few things which I do want to continue to discuss. Of course, here's just a picture of all of us. I do want to also shout out two fantastic volunteers that you see in this picture on the previous slide, which was Aislinn and Jerry.
Just backtrack that slide there.
Yeah.
These are another. There's Stuart and there's Aislinn and there's Jerry and then you got the old farts like me. By the way, the difference of an old fart means that you can pass gas anywhere you want to, no questions asked. You see, so I made that stage in life at this point in time. Just kidding a little bit about that, but you can see the strengths of younger people that really want to make a difference, and these three people are among many who make a huge difference, and I'm indebted to all they've done. Thank you. A special thanks to Dong for creating this work of art that I will cherish, and I hope you cherish as well.
Thank you. And on the next slide, Nurme, in the spirit of giving, and of course in the holidays, we've donated to a number of different places over the past year, and we just wanted to list a few of them. Over the next few months as well, we'll be continuing to donate whenever we can to some other charities and nonprofit organizations and other important causes which are important to us. If you do have any causes that are important to you, we'd love to also consider them, as well as we continue to look for new places to contribute proceeds to, and you're always welcome to email us. We'll share our email at the end of tonight's presentation if you would like to do so. And also my final message to anyone who's able to in the holiday season and are able to donate or share proceeds to a particular organization that's personally important to you or personally relevant to yourself or a family member, I encourage you to do so if you're able to.
So one of the things that's important is that the world is not in a good place right now, and the way the world gets to a better place is to work together. You know, the needs of one versus the needs of many right now, and what this has taught me is that that we're in trouble because we're not working well together. If we work better together, better things will happen. So it's the same thing for controlling blood pressure, cholesterol, or health is working together. And these are some of the different organizations that are important to people in our clinic, to our students, to some of our patients there. So so I'm glad that we can contribute, and by the books that we create or things of that nature, that all goes to that too as well. And many of the talks that I give to too as well, we're gonna do that too as well. So I'm privileged to be able to do this, and it's the help of so many people. So thank you all for all your hard work.
And Nurme, if you want to transition over to the last slide, here we've got some screenshots of some of the many people in our clinic, staff, volunteers, and of course our patients, which you can see on the right-hand side, some of our stellar patients who are joining in many of our different focus groups, which we have going on at the clinic. Dr. Curnew, did you have a message to share with these pictures?
You can see in red is Jen. Jen is sort of one of the foundations of our clinic. She keeps us safe, she keeps us organized, and I thank you, Jen. There we see Mira, who got a Christmas surprise from the weight loss team. You can see both of these individuals have lost sizable amounts of weight, and they're working hard, and it's a great group. People say they're tired of Zoom. I'm not tired of Zoom. I'm tired of people not trying. I'm rejoice when people do try, and it only makes me smile when people are doing their best. So the key message to me is, don't be hard on yourself if you don't make it. Be hard on yourself if you don't try. That's all I have to say. And try different ways.
And on the next slide,
for the world.
Yeah, and on the next slide, we got a picture of Dr. Curnew with his gray cuff scarf. What are your thoughts on the
Yeah.
result of the game the other day?
Yeah. So it's interesting. You can think of the Grey Cup as being a failure, or you can be a success. To me, I'd never been to a Grey Cup game in my life before. My son came with me, and we were sitting up in the bleachers. To my right was this young lady that been to 6 Grey Cup games. To my left was very mad at Winnipeg and the Ticats for every mistake they made. And so to me, that the Grey Cup was a very huge success. Just making it to the Grey Cup is wonderful. You can see the Ticats played their hearts out, and what more? And so I want people to play their hearts out and work hard. And the Grey Cup was very successful. I got to spend some time with my son. In fact, my son at one time played in the Ticat Stadium before it was Tim Hortons Field, and I hold the sticks, and it was so close, and it's wonderful. There's always next year. There's always next year to improve your health too as well. So we should learn from professional athletes is that they don't give up. They just find new ways and they keep getting better. And so keep finding better ways to be healthier, and keep working at it. And don't be so hard on yourself if you don't make it. Just be hard on yourself if you don't try, don't find the time.
And finally, Dr. Curnew, your message about some of the foods that we have in the clinic on the next slide. We've got a picture of our kitchen.
Yeah, so today was our, we had a little bit of celebration today. So I love those edible fruits, eat fruits and vegetables. I have my pot of coffee every day. You can see balsamic vinegar in the corner there, some tangerines, some goodies. And Jen gave me a brand new gift, my jet stream. So I try and make water my number one beverage, and add some carbonated water because that's wonderful. So I thank everybody, and how to celebrate them during this time is celebrate well, celebrate, I guess, more in isolation right now. And I'm very grateful. And yesterday, one of the patients or two brought in a bowl of soup and things of that nature. So so thank you so much for everybody's kindness. And right now is that it's interesting is that I got some gift cards to give out to different people and things of that nature as well. And so so when it's fun to just give things to people who don't expect it. So watch out as that. I might buy you a coffee. I might buy you hopefully a healthy sandwich or a bowl of soup or something, and just enjoy and just be healthy.
Dr. Curnew, if you're taking requests, I'd also like a Tesla, but I know that maybe is a little out of the price range.
Yeah. So is that what I love about the Tesla? It's a car that gets better. So how many cars can you say that? It keeps learning. So um, I'm learning. Tesla's learning. And one of these days we'll all have our own electric car. Um, and uh, and uh, and so keep moving forward, and keep learning and
Perfect.
keep exploring.
Great. And finally, I just wanted to conclude on the next slide with just a little bit of a message on the current states of our pandemic in Ontario. In light of current events, of course, there's been quite a few recent changes to the way the Ontario government is operating and the provincial government, just in terms of management for the variant. And so, of course, we know the Omicron variant is a very real thing. It's spreading quite rapidly in Ontario. The rates are doubling, it seems, every 3 days, and by the end of the year, they're predicting that you're going to see about a 10K positivity or case rate with the Omicron. And so it's important to be vigilant. It's important to be mindful. And I just wanted to briefly highlight some of the recent changes that have been made for those who maybe are unaware. Today, the government announced that a lot of indoor venues, whether it's grocery stores, malls, sporting events, etc., have been limiting capacity down to 50%. There's also been quite a few changes in terms to how fast an individual can get a booster shot. As opposed to 6 months now, starting on Monday, an individual who's had their second dose can subsequently book to get their booster shot 3 months, as opposed to the original 6 months. And finally, there's a lot of also places such as the LCBO, as well as malls, pharmacies, etc., which are now providing free rapid tests for those who'd like to get tested, of course, for those who maybe are expecting to be hosting small gatherings. And in the light of small gatherings as well, they recently made a change so that it's small gatherings of 10 people indoors and outdoors a limit of 25 individuals. And finally, of course, there's also been a lot of talk about restricting traveling across the countries and to other parts of the world. My family had to make a very difficult decision today to not go to South Carolina to visit family over the holiday season. We know it's a difficult decision for many. This tough situation calls for tough decisions, but we just want to urge everyone to be mindful of making decisions that are best for both your health and the health and safety of others as well. And that's why we wanted to show some pictures, of course, of Dr. Curnew's son getting his, I would imagine, second shot in this image. And the images on the left, you see some members of the Hamilton West 5 COVID ward who are doing an incredible job with the tremendous number of cases which are coming in and out of their doors. Dr. Curnew, did you have a message for your experiences as well when you visited the COVID clinic?
I just think is that vaccines have made a tremendous impact in many diseases. So this year I got my shingles, I got my Prevnar 13, my tetanus is up to date. I've had my 3 shots for COVID. I'm thinking to get every effing vaccine that I think is there. Vaccines have proven their value over and over again. Don't forget your flu shot. Remember, if you have heart disease, having a flu shot will decrease the chance of having a heart attack or cardiovascular events by 25% and decreases total mortality by 40% in high quality randomized data sets. Viruses, bacteria damage vessels, and that damages your heart, they damage your brain. I don't want to get infected with anything I don't have to. So if you want to be brave and get natural immunity, good for you. I will get infected with different organisms. Vaccines don't prevent you from getting infection. They decrease the severity. They give you a first defense against infections of multiple sources. And so on the left, you see 2 heroes from the COVID ward. That ward was closed. I'm fearful it might have to open up. And there are 3 reasons to be vaccinated. 1 is to protect yourself. Number 2 is to protect others. And number 3, to decrease the amount of mutations. And just think very, very importantly, are you in it for yourself or are you in it part of your community or what combination of all the above right now? So here are the shoppers downstairs have vaccinated well over 5,000 people. And I thank Rami and his team for working those long hours. I think that Hamilton Health Science and all healthcare providers that are the true heroes. We're all tired. This pandemic is not gone away. It's time to be up with resilience. And so wear proper masks. Surgical masks are better. If you're going to be in a place with lots of people, get an N95 mask. And cloth masks, well, different quality of cloth masks, you use them, keep your social distancing, wash your hands a lot. And look about the power of vaccines. So a good patient, a good doctor treats and recognizes disease. Even a better patient, a better individual prevents disease. And that's what vaccines are all about. So can you get any guarantees? No, but we're going through scary times right now. So if you think you know more than the medical experts, good for you. I rely on medical experts who know a lot more about multiple diseases, and we're glad to share that with you. So think long and hard what you're doing.
And with that, I'd like to move forward 2 slides ahead, and I would like to pass it over to Adam, who's going to be discussing today's topic.
Awesome. Yeah, so can you hear me all right?
Yeah.
Yeah.
Perfect.
Here we go. Yeah, so just our type of content for today, we're going to be talking about BMI, what it is, just some BMI and COVID-19 stuff, and cardiovascular risk, as well as some factors that affect BMI. And yeah, so different scales as well. What are some alternatives? Yep. Okay. So on the next slide here. Okay. One after that. So we're going to start off with what is BMI. Okay? Fortunately, it doesn't stand for best medical information. On the next slide, Jeremy. Yeah, there we go. It stands for body mass index. So it's a very easy, inexpensive way to sort of screen for different weight categories. So we have below 18.5 is considered really underweight. 18 to 25 is normal, and then above 25 is overweight. And so where we want to be is generally 20 to 25. That's reasonable where category to be. And we'll discuss more about why that is and how that affects us. But on the next slide here, this is a really, really neat chart that I'm going to use. Again, just to sort of keep in mind, BMI is not used to diagnose anything. It's just sort of used for screening and context. And we sort of use that to keep in mind. So if you look here at this table, I'm 6'3", so I'm going to go down that column on the left side. 6'3", there we go. And I'm around 160. So I actually just weighed myself clinic here. So 160 would be around, yeah, that'll be around 21. 21. There we go. So my BMI right now is 21. And again, you want to be within that range, right? Like we discussed, 20 to 25, and the green category. And the way you calculate it, if you'd like to at home, is just get your weight in kilograms and divide that by your height twice. So
you can actually use, depending what scale you can use, you can do kilograms or you can do pounds. So for instance, I'm 167 pounds. So and I'm 5'10" or 5'11". What's my body mass index? Around 23-ish, okay? And what I learned is anything north of 24, COVID likes to kill. And so when I found out that COVID really goes after as we get older, as we gain more weight, as we have high blood pressure, if we have diabetes, and it actually accelerates diabetes. So I decided I'd get myself in the best fighting shape possible. And thanks to the whole team, I lost 20 pounds and I'm hungry every moment of my life. But my weight's down. I'm going to keep working at that area. And we're going to show you if I can do it, you can do it. And we're going to keep working it. Some days I'll get there, some days I won't. And so I think everybody should know their body mass index. Simple as that. And we'll talk about the pros and cons of that.
Sure. Okay. Yep. So on the next slide here, just some considerations we want to take for BMI. So at the same BMI, so this is the rest of the sentence, right? At the same BMI, women tend to have more body fat than men. At the same BMI as well, folks of Asian descent tend to have more body fat than white folks, as well as African Americans tend to have less body fat than white folks. So this is just some considerations for BMI. If you have the same BMI, doesn't look the same thing for same people. Older people on average also tend to have more body fat for the same BMI than younger people. And at the same BMI, athletes have less body fat. And that kind of makes sense, right? They have more muscle. And so, yeah, again, with BMI, you have to make another consideration. So two people could be at the same BMI, but one of them is like pure muscle. Another one is not so much. So that's where we have to bring in context and, speaking to your healthcare professional and so on. But it's a good screening measure. It's a good thing to keep in mind. Anything you'd like to hear? No? Okay. So on the next slide. So here's some mindset things that I'd like to keep in mind. And we could maybe just sort of discuss what each of us think. But personally, so one of the things I often hear is I don't have time. And that's something I struggle with as well, with a lot of competing priorities. And so the idea is I don't have time, that's right, but make time for it. And so integrate it with stuff that are already in your calendar. So for me, it's like social activities, for example. I integrated soccer. I'm a really big fan of soccer. And so I integrated my exercise into soccer, like social activities. And so that's where I get my exercise from. And, another one is, for example, I don't know where to begin. And that's a very fair thing. A lot of us have that being scared of starting. And to me, our books, our webinars, our meetings that we have, there's so many action items. And we'll talk about the action items towards, but there's so many things to know where to begin. And the clinic can be your first step. Again, I want to do it alone. That's a very common one. You don't have to, find a partner. That's one of the best ways to sort of keep a habit is finding a partner, sort of thing with them. And that's where the social aspect comes in. Another one is home gyms or just gym memberships in general. The truth is you don't really need one. Walking outside, doing a lot of activities, calisthenic activities just at home. That helps a lot. And our exercise crew are really, really good at that. And I'd really recommend you guys check them out. Another one is feeling too tired. And funny enough, the solution is to exercise if you're too tired. It helps you just feel much younger, much better, and that's that.
Kind of interesting. Don't have time. Well, let's say you had a flood in your basement. You don't have time to turn off the water. So to me, it's how to carve time to make health a priority. I don't know where to begin. Well, I'm going to ask people starting day 4 is to spend 5 minutes a day looking at our YouTube site and spending just 5 minutes looking at a different video. If anything, it will help you sleep. It will, so to me, either start the day or end the day, I want everybody to actually spend 5 minutes every day just looking at some of the stuff we produced. Okay, you don't have to agree with it, but it's a good place to start. Now, many people say I do it myself. That's fine. I think most of us were social critters and working together in some way. And well, I think right now the best place to be outside is to be outside right now. You're 35 times less likely to get COVID outside compared to inside. I'm tired all the time. I was born tired, I'll die tired. But you know what? I want to make my life worthwhile, and I want my brain to function. I want to be out of the nursing home for as long as I can, and simple walking, being around some form of activity is important. So you have to decide if your health is a priority and how to make it so. It's not easy every day, but it is something to think about. If you don't know your weight, get a scale, measure it often. I measure mine almost every day. Know your body mass index, and we'll also talk about body composition if you want to get a little bit more detailed about that as well. Any thoughts from anybody else, or we just keep moving forwards here? So what I want you to do is can't manage what you don't measure, so know your weight.
Sure. And so with that in mind, we'll sort of give a shout out again to our YouTube videos. So if you just go to youtube.com, in the search box, which is the top thing you're going to see up there, right? Dr. Curnew mindfulness. That's a big thing that we want to emphasize this webinar is, again, like Dr. Curnew mentioned, just don't be hard on yourself. You know, it is a journey. It's a marathon. So we're talking about exercising. It's going to take a long road, and being mindful and just being in a good mindset is really, really important. Another one, if you search up Dr. Curnew weight, you'll find a lot of videos about weight loss, different things to keep in mind. So it's really, it's a great starting point from there.
So we just came up a few days ago about 5-minute meditations, gratitude. So that's a good one to start with, I think. So from Hannah and so many other people that have made so many of these pearls, they taught me a lot. And one of the things is I haven't been thinking much. I just react. Now I'm trying to react less and be more mindful. Obesity and cardiovascular disease, that's something you should think about. Should I have weight loss surgery? Take a peek at this. You see something on Ozempic. Ozempic, to me, is one of those game-changing potential medications. Should I be on a statin or not? Yes, the answer is you probably should. You should probably take a bigger dose than you think. Let's keep moving forward. These are just some examples. You can just search what you'd like to. Go ahead. Next slide.
Just like on that point, just mine, Dr. Curnew's wish, and everybody, I guess, is just spend 5 minutes a day looking at these things. I'm not going to sit down and ask you to sit down for an hour, because sometimes that might be difficult for you. So one step at a time, 5 minutes, we just sort of move forward.
So I'm going to take my Rovastatin 40 milligrams today, 10 milligrams of ezetimibe. I don't know if you're taking yours, but I'm taking mine.
Awesome. Yeah, actually, with that in mind, we're going to talk about cardiovascular risk and BMI. So on the next slide there, these are just some things BMI just puts you at risk at, and we're going to talk about some of these things as well. So high blood pressure, as well, just sort of keep in mind, we want to keep measuring blood pressure almost every day or whenever is available, just because blood pressure is not, you can't just say it's normal. It jumps up every day, depending on what you're doing. So we want to keep an average, just sort of keep in mind where it's likes to be. BMI also puts you at risk at high LDL cholesterol, high levels of triglycerides, type 2 diabetes, coronary artery disease, coronary heart disease, stroke, sleep apnea, and some other body pains and physical functioning that's going to affect you. So a lot of things we're going to talk about, but just keep that in mind. It's such an important thing.
So
Okay.
everybody should think about how to get a body mass index between 20 and 25. I know it's a tall scale to do. I'm having a sweet potato right now. Just put in the microwave. It only took 4 minutes to cook. And a few antioxidants, some real food. I feel full after a sweet potato. I'd rather have chocolate cheesecake, but I'm gonna join you tonight with a sweet potato. Hope you enjoy that as well.
And they're surprisingly good cooked in the microwave. I didn't really expect it, but it's really doable. Just sort of put it in there. 4 minutes?
4 minutes.
Yeah, 4 minutes. There we go.
And thank you, Stuart, yesterday for that wonderful cookbook, eating plant-based eating on a budget. And here's one way of doing it too as well.
Right. So on the next slide here, BMI and COVID-19. So here's one study that's really interesting. So the total of 10,861 patients were that were affected by COVID-19 between March 1st and April 27, 2020. What the study tells us is that patients who are underweight, like severely underweight, or were overweight, or even in the obese category, were at higher risk of mechanical ventilation or death. So if you just look at the chart on the right, it's a bit complicated, but I'll walk you through it. At the bottom over here, you see 243 underweight, and 95 died, or 30 intubated. And it might not seem like a big number if you look at the rest on the right side, but again, this is a ratio, right? It's 240. But then normal is normal. And then we look at overweight, or even on the obesity scale, you start to really see these numbers ramp up. Even doubling. So again, we want to keep that in mind, is that's why we say it's such an important thing to keep your BMI controlled, measuring it often, because it plays into all these different factors. And COVID-19 right now hasn't gone away. If anything, we got a new variant. So we definitely want to stay safe as much as possible.
So again, edible, ways to get more fruits and vegetables. And so this is a leftover from our office lunch today. I'm trying different ways to be creative and things of that nature. Is that think about your weight is one of the pillars. So again, think about how to get a body mass index between 20 to 25. I'm not saying you're going to get there, but that's what it only took me 60 years to get there. Hope you do yours a little bit quicker than myself. Next slide, please.
So this study was actually really, really interesting to me. I'd love Dr. Curnew's thoughts on this one. But so what they did was they mapped out the relationship between BMI, so body mass index, and the incidence of heart failure among 5,800 people as part of the Framingham Heart Study. So that one is a really famous study for heart analyses. And what they found was that after adjusting for certain risk factors, there was an increased risk of heart failure of 5% for men and 7% for women, with each increment of one body mass index. So 20 to 21 to 22 to 23, each time it's just higher risk. And it's one of those things that I really found appalling. And it's just like BMI and heart failure. And I'd love, Dr. Curnew's thoughts on heart failure. It's like,
we can see that, we just talked about how body mass index affects infection. It's not just COVID infection, but any infection, because it questions your lungs when you're overweight. You have more cancer, you have more heart failure. The only good thing about being really overweight, if we go through a severe starvation for about 6 months or so, you hadn't eat or drink, and you can be like a bear, you probably survive. But I don't think we're going to be missing any food for the next 6 months or so. And so you can just see, we can go on and on. It's one of those foundational things. And unfortunately, less than 30% of Canadians have a reasonable body mass index at this stage. So we need to worry about that quite a bit. Next slide, please.
Yep. So this one is, so this one is related to diabetes. That one is also a really interesting study. So it was part of the National Health Interview Survey, and they linked mortality between 1985 and 2011 for almost 500,000 people. And so what they found was the lifetime risk of diagnosis of diabetes for 20-year-olds was 40% for men and 39% for women. And the lifetime risk increased for Hispanic men and women and non-Hispanic Black women as well. And on the next slide, there's a neat little chart over there, which we'll walk through. So
just backtrack one slide. basically, if you're 20 today, the chance you developing diabetes in your lifetime is now is about 40%. I'll repeat that. Average 20-year-old today has about 40% lifetime risk of diabetes. We have to, and basically one of the biggest changes is we're not as active, but more importantly, our weights are skyrocketing. So we can go to the next slide. We don't have to say any more about this. The data is the data, but this is an important slide to think about. If this is what you want, if you want an average 20-year-old person to develop diabetes, keep doing what we're doing. Next slide, please. And I don't think we'll just talk about this. Is just more detail. That's mumbo jumbo, good research quality stuff. But I think just want you to realize your weight is important. Go ahead.
Yeah. And actually on that point, again, physical activity is one of those things where the worldwide average is crazy. So worldwide, 1 in 3 women and 1 in 4 men don't get the enough recommended physical activity to stay healthy, according to the WHO. So it's it was also a really recent study, 2020. So the levels in activity are twice as high in high income countries. So that affects us twice as much as low income countries. And you'd think we'd have more leisure or availability to exercise, but the data says different. So that's why we really got to push to exercise as much as possible, push yourself as much as possible. Yeah, so these are some crazy numbers here. Would you like to comment here? No, good. So liquid calories, that's something I don't know, I find interesting personally. So if you look at oranges, for example, a fresh orange is 62 calories. Orange juice is almost double, so 110 calories. Fresh apples, 95 calories. Apple juice is 114. Beer can, 154 calories. And wine glass, 50 ounces is 160. So it's one of those things where we don't really think about it much, but because it's liquid, it's so easily digestible, and you might have 2 glasses or 3. And if you look at, for example, the daily recommended calories, for example, is 2,000. And so if you were to drink a beer or a wine glass, that's already 8%, for example, 8% of your calories for the day. And that might increase. So just keeping in mind liquid calories, because it's one of those sneaky things that sort of comes into your day and you don't really notice it.
So what I've tried to do is make water my #1 beverage, and it's between coffee and water, but I got my carbonated water at this time for Christmas. And so liquid calories, so start every meal with 2 glasses of water, you'll actually lose 5 pounds. And so we don't have orange juice or juices in the house anymore. They're just like liquid sugar, and you don't need them. So that's an easy pickings if you really care about your weight. That's the same thing with alcohol. Alcohol, each gram of alcohol is 9 calories, and you don't need the calories. Next slide, please.
There you go.
Alrighty, so we'll look at some different factors that affect BMI, and I think Adam kind of touched upon this a little bit, but I've listed a bunch of things here. You can see a lot of things in the little tables themselves when they're looking at university students specifically. But the ones that are, I think, the most important to highlight are age, muscle mass, and then diet and physical exercise. With regards to things like just age and muscle mass, I think we've kind of touched upon it a little bit, where we've noticed 2 kind of trends. We've noticed that you can either, when your age increases, your BMI is going to increase, and also when your muscle mass increases, your BMI is going to increase. The biggest takeaway from this is that although these are the things that are going to happen, we know that some of these things aren't really in our control. Like age is not really in our control. One of the downsides of using BMI is that, if you are very, very muscular, you might have a higher BMI, but that doesn't really mean it's a very bad thing per se. So what I want to kind of take away from this is that let's focus on the things that we can really change. Let's focus on things like diet, and then let's focus on things like physical exercise. So what the research shows is an increase in a healthy diet, or having a healthy diet will kind of be proportional to a decrease in BMI. And how can we do that? The ways that we can kind of work on that is, first we need to focus on something known as calories in versus calories out. So if you've worked with our weight loss clinic, our weight loss club at clinic, you've probably heard about this term. Calories in versus calories out is measuring your calorie expenditure versus your calorie intake. And to be on the downward trend, to lose BMI, there's two things you can do. There's A, you can grow your height, or B, you can decrease your weight. It's going to be very hard to grow your height if you've already reached puberty. So what we want to focus on is we want to focus on decreasing our weight. And this calorie deficit is what we call it. When you have more calories that are being burned than the amount of calories that you're putting into your body, that is going to be the best way for you to lose your weight. And when it comes to this weight loss, exercise will help a lot, but it isn't the only solution. You have to really work on your diet as well. So one of the ways I like to think about it is that exercise will allow you to eat a little bit more food, but at the end of the day, you need to also focus on picking out healthy diets. Because if you say, you go to the gym for 2 hours, but then you go home and you have a Big Mac every single day, it's not really going to work out perfectly. Something else that the research shows is sometimes it might be smaller meals throughout the days than just bigger meals, and that might keep you less hungry throughout the days, and it'll avoid quick snacks or nighttime snacking and things like that. Again, we also want to have diets that are a lot more higher in things like lean proteins, fruits, vegetables, and lower in fat and carbohydrates. And the reason being is that these fruits and vegetables, they contain a lot more fiber. That helps us feel full longer, but it also means that we are not going to be eating too many calories. And we have a lot of videos on diet. So if you go back to our YouTube and you search Dr. Curnew diet, you'll see a lot of videos on specific diets that you can go watch at your own time and try to find something that really works for you. Even our book, 30 Days to Healthier You, which we'll talk about a little bit later, is a great way to find some good recipes that can work for yourself. And the last thing I want to say about diet is that there's no quick fixes. There's these diets out there that are going to say, oh, this is only a 1 month diet and you'll be great. Or this is only a 1 week diet. We want to find a sustainable long-term solution for yourself, right? So that's why we recommend trying to incorporate things into your meals that you would really enjoy, and trying to look at the videos and all the resources that you already have to find what works best for you. And then we're looking at something very, very similar with physical exercise. So the more physical exercise you can get, the lower your BMI is proportionally to a certain extent. And the reason being is, again, physical exercise can definitely help with things like weight loss. The number one kind of exercise that Harvard recommends is, believe it or not, walking. It's not something very elaborate like going to the gym or going on a 5K marathon or anything like that. It's just walking every single day, walking consistently. Then if you want to progress from walking, you want to do something a little bit different, you can always jog, you can always cycle. You have to find something that works best for you. So here we have a few examples with jogging, cycling, weight training, interval training, swimming, yoga, Pilates. Find something that works for you and then be consistent with it. That's probably the number one thing. It's develop that willpower to be consistent with whichever exercise you choose. If you choose to walk 30 minutes every single day, up it to an hour every single day after, try to do that consistently. You won't see any sort of, benefits immediately, but over time, there will be a great benefit and you'll be able to see that. But these are some good ways you can kind of start working on decreasing your BMI. Alrighty. So we've talked a little bit about BMI itself, but there are actually other ways to also measure something very similar to BMI. And so what we have here is we'll talk about something known as the relative fat mass. We'll talk about skin fold calipers, and we'll talk about bioelectric impedance. So the first one, what is our relative fat mass? So this is another way that you can actually measure your your relative fat composition. So what it does is that it looks at your waist circumference, and it also looks at your height. And the reason why some people prefer this one, although it's not as popular as BMI, it's also very easy to measure. You sometimes just need some measuring tape to really measure weight and waist circumference, height and waist circumference. It's also pretty inexpensive. All you need is that measuring tape. And it's very strongly related to body fat in adults. So it's actually one of the most accurate methods out there. And studies really do show that waist circumference predicts the development of disease and death. So here we have kind of an example of a form. So here's the formula on the left, but here we have an example. Let's say we have a single tall person who has a waist circumference of 30 inches. If you measure everything in centimeters and then you put it into the little formula, it'll kind of tell you, in this table, what kind of level of fitness you're at. So we're ideally looking at something in the fitness or average range, and obese would be higher. And so once again, just to clarify, this is a different scale, not the BMI scale, but this is another scale that you can use depending on what's available to you at your house. If you say you don't have a scale right now, but you also want to measure something, if you have some sort of measuring tape, this is one way you can kind of measure your relative fat mass and see, what the best solution is. Because once again, all we want to do is, at first we want to find out some sort of a benchmark, and we want you to work on yourself, try to improve, and then you'll have something to compare to your mark. And so this is another way you can set a benchmark for yourself if you don't have access to something, say, as a scale. We also have something here. You might have seen this before, or you might even own one at home, but it's a skin fold caliper. So this is a very simple tool. You can pick one up for a couple bucks on Amazon if you're looking for something like that instead of trying to buy a scale. But all it does is that it pinches your skin, as you can see over here, and it measures the fat, kind of the distance of the fat tissue fold. Again, some of the best advantages of this one is that it's very convenient and safe. It's inexpensive, and one of the advantages it has over something, say, as a scale is it's relatively portable and fast and easy to use. So you can put this, if you're going on a trip and you want to bring something that can measure, improvement over that trip, say it's a longer trip, then instead of bringing something like a scale or finding a scale at the place you travel to, you can pick one of these guys up and put it in your travel luggage. So this you can kind of use in your stomach, but you can also kind of use it in a lot of different places, such as like the trunk, the front and back of the upper arm, eye. So there's a lot of places you can put this. And here is a way to interpret the chart and the body fat percentages. So depending on your age and depending on the measurement itself, you can kind of see what the normal or ideal average and over fat ranges are. And one of the nice things about this one is that it kind of calibrates for age. So as we can see, as we get older, there's a greater kind of measurement you can have, and you would still be considered in the ideal range compared to at a younger age. And the last thing we kind of want to look at is bioelectric impedance. And so when we're looking at that, what we're looking for is it's a way to kind of measure your, it basically sends an electric current through your body, and it looks at how your body can resist that electric current. And so sometimes this will be placed in your scale itself, and it'll give you a percentage as an estimate of body fat percentage. Again, it's pretty relatively convenient and safe, and it's very inexpensive and easy to use. So this could be another way that you could try to find your body fat percentage if you don't want to use a traditional scale and height method. And this works really well if you don't have access to something that can measure your height. Alrighty, so I think that was kind of where we wanted to kind of talk about some of the most important things today. And then what we'll do here is we'll kind of just talk about 30 days to a healthier you as well.
I don't care how you measure yourself and do it often and do it in the same schedule. I just use 3 different scales. I got 3 different results. Kidding around, they're all about the same, unfortunately. I'm still not always happy with it, but I'll keep working at it.
Can I ask a question, please?
Please.
Yeah, go ahead.
With the bioelectric impedance measurement, how is that for somebody? My question for someone who has like, what do I have? I have the electrical parts of my heart that don't work properly. So does that affect that, putting electrical current through your body? Just curious.
I'm sorry, do you have a pacemaker or anything?
No, I don't. I just
No,
have...
don't worry, nothing to worry about.
Okay, that was my question. Thank you.
Yeah, and it's like you wouldn't even feel it. It's I've actually used one before, and when you stand on it, all it feels like is like you're standing on a scale. So some of the scales these days have a built-in bioelectric impedance monitor in it, so it can give you a body fat percentage measurement as well. So even though it says that it'll, kind of send an electrical current through your body, it really is basically just measuring the resistance of the body which is in contact with the measurement. So if you were standing on a scale that had the bioelectric impedance in it, it would kind of be looking really at your toes and looking at like the fat pad on your toes and seeing, and then measuring from that what your body fat percentage would be like.
Thank you. Very informative program. Appreciated it tonight, folks. You guys did a good job.
Thank you. No problem. Yeah. And here we just want to bring it back to the Dr. Curnew's book, 30 Days to a Healthier You. So the main kind of reason why we kind of promote this book a lot is that it gives you very realistic and feasible advice to achieve a healthier lifestyle in 30 days. And the one takeaway that we want you to have really from this kind of webinar is that we don't want to fall into the excuse of, using things like I'm too busy or I'll do it later. As Adam earlier said, we all are, very, very busy in our lives, and it's not a matter of finding time. It's about making time. So it's about maybe changing up activities. One of the things that I started using is I really like to watch a TV show on Netflix. But what I do now is I'll only watch that TV show, if I'm also cycling or if I'm also biking at the gym or something like that, or using or running on the treadmill. So I've kind of merged 2 activities that I really like to do, but I'll do them together, and that's how I'm finding time. So you have to really find something that works best for you, but try to make time to do this. Make time to find, make time to plan out your meals ahead of time, and then have a healthier diet, or make time to go and work out, or go for that 1-hour walk every day to lead a healthier lifestyle. And this is just a good summary of what we kind of talk about in the book. So we have our, we start off with talking about things like how to control your health, how to get the best out of all your appointments. And then we talk a little bit more about the actual diets themselves, We touch on things like supplements, multivitamins, micronutrients, if they're myths or if they're facts. And then really near the end, what we do is we come up with a lot of healthy recipes there, things that you can incorporate into your own lifestyle, goal setting, and things like that. Anything that anyone wants to add for this slide?
What's kind of interesting is that I put myself on the scale. I didn't like what I saw. And they said, well, my clothes are all different times of day, but you know what? I'm gaining weight where it's Christmas time. I took 3 medications just now. I took ezetimibe, 10 milligrams a day. I took Crestor, Rosuvastatin, 40 milligrams a day, and 0.25 of Ozempic. Right now is that I really want to concentrate on my weight right now and really being healthy. And I had some fruits and vegetables. I had some sweet potato. There's some treats out there. It's hard to resist, or none of us are perfect. So, but I'm really working hard on it, and that we're going to make sure that we all work hard together on this. And the book is really, if you want a 30-day program, I'll give you a 30-day program. The book is either could be 30 days to healthier you or 130 days. So it's 10 times 30, 100 times 30. And we have this 30 and 30. So for many people, losing 30 pounds will put diabetes into remission if you're overweight. And that's kind of important. Am I disappointed with my weight today? Yeah. Am I upset? No. So I'm going to recharge. And as the Thai cats came close, I'm going to get closer to my goal weight. And I'm going to rearm myself. So I hope this information, measuring is important. And I hope this book is something that you find helpful for you and your loved ones. It talks about so many facets of your health and ways to track that. So, and also a little bit of sense of humor, I hope.
Sure. We'll go on to the next slide here. Okay, there we go. Right. So honestly, a lot of these things we might have discussed you might have already seen it. A lot of the stuff maybe you've seen before, you already know it. But the thing is, knowing and doing are 2 different things. And I think as well, sometimes a helpful reminder is really useful. And so we have our weight loss crew and our exercise crew, which we've discussed earlier. Finding a partner sometimes might be difficult. So we could offer you one. And if you don't know where to start, we could help you with that as well. So we have our Zoom calls Tuesday evenings at 7 p.m. We have one-on-one support Tuesday afternoons between 4 and 7, and Saturday mornings between 10 a.m. and 12 p.m. This is for weight loss, and for exercise crew it's Wednesday evenings. And if any of this interests you, please reach out. Like, we're here for you. We're here to help you, and we're here to build that support. Especially right now, I think with Christmas, with holidays, a lot of us might let go for some of our goals, but then restart in January. So I think the name of the game here is taking action. Just knowing is not enough, just doing is a really important thing. That's why we named this section action items. And then the next sugar hour, which we'll talk about next for Sugar Club, we're really emphasizing action. So on the next slide here, we also have our cooking club, which means once a month on Sundays over Zoom from 4 to 6 p.m. That one's really neat. We discuss different cooking methods, or like different foods, different diets, stuff like that. And again, it takes you into the action phase. You could either just come and watch, or you could just cook with us. And I really think it's a really, really valuable group. Yeah.
No, I think, these are just things how we share. Aditi has done some remarkable work. She's been a vegetarian for a long time. I'm going through that pathway in many ways. There's Dr. Ganguly, who has a 6-week program for people who want to be plant-based, and Food as Prevention is his website. He's a great guy. I've learned so much, and I really enjoy this happens. The only person who doesn't like the Sunday events is my wife, because I make a mess of the kitchen, but she lets me do it once a month, and it's so much fun. I hope you can join us.
And the way to join us is just the Google Forms that should be linked in the description. You could just sort of come in and pick the different things that interest you, and somebody will reach out to contact you and book you in for the support groups as well. The next slide here. Yeah, there we go. As well, this is on our YouTube channel, youtube.com again. We've mentioned Ozempic a couple times, and you could find it by just searching youtube.com. And then once the screen loads up, you'll find a search bar on the top, just write Dr. Curnew Ozempic, and it should be the first video. I know it looks like it's an hour and a half. It sounds really long, but honestly, it was really, really fun, and it goes by really fast. There's a lot of really interesting information, a lot of really interesting discussions, and there's really, a lot of sharing. It wasn't really presentational. On the next slide there. I guess lastly, we'll just sort of finish up with the Cardio Mobile. We've mentioned it a couple of times in our different webinars, but Cardio Mobile is like this really neat device. You'll see it here. It's right under the phone. It's small. It helps you, just measure heart rhythm, and it's another vital for us to track. Blood pressure is one, the Cardio Mobile is another. And so on the next slide there, we'll talk about things we want to measure. So blood pressure daily, walking up to 3 times a day, and measuring the heart rhythm before and after. Any symptoms you're feeling. So if you feel like you have chest pains or palpitations or shortness of breath, whatever it may be, just sort of measure it and see if that something comes up. The other thing is the 6-minute walk test, which is really a neat thing. You put 2 pylons that are X distance away from each other, let's say 5 meters, and you sort of walk for 5 minutes or 6 minutes, and you see how much you could walk. And that's a little competitive thing you could do with yourself once a week. And reading 30 Days to Healthier Use. So for Cardio Mobile, we have a team for that, as well as for Sugar Club, we have a team for that. We'll be starting for in the New Year's in January. It's called 30 pounds at 30 weeks, which, again, it helps you with the action phase. Over the 30 weeks, we'll rotate around all the different clubs. So we'll be rotating around exercise club, the weight crew, the cooking club, just getting a little bit of everything and putting things into action phase and just sort of following up with the individual support. And you'll see the email down here. So if that interests you or rings a bell, just shoot us an email and we'll definitely be more than happy to help you out. Yeah, and I think that pretty much comes to the end. I guess any final words, but.
So to me is that when I hear a number that almost half of a 20-year-old today will become a diabetic in their lifetime, that's no longer acceptable. You can say there is genetic, the environment, I'm too busy, I'm too tired. The field of weight management is fought on many fronts. So if you have problems with your mental health, get help. If it's something simple, we can give you support and help. But if you really have serious depression, anxiety, PTSD, speak to experts in the area, either online or the right people. What I take away from this is that I weigh myself almost every day. I'm going to start spending a little bit of time with body composition. It's more for fun, but just knowing what your weight is and you use the same scale on a regular basis. Do it with somebody else, your spouse, your friend, your dog, your cat. I don't know if you can walk a cat. I walked sheep and goats at one time, and they're kind of fun animals to go around with. So, I learned a lot about cooking from Aditi and some of the different participants who come to the club. Mira and Devanchi's done a wonderful time, and I look at the group from Jerry and others that Hannah, who prepared these videos on mindfulness. They've helped me become a stronger, better person, developing more resilience over time. And I guess my plea to everybody is that, there's a certain amount of hours in the day. The last 2 to 3 years of your life will be spent in illness. So you can either delay that, and one of the simplest things is keep moving, keep walking, and that's important. Paradoxically, the best therapy for arthritis is activity, if it's done properly. And I think just moving forward is now part of the field of weight management. I admire some people is they can stop eating. I'm always hungry. And we talk about chemical imbalances in the brain and things of that nature. So Ozempic and Contrave are medications that can help with that in the right circumstance. I'm not saying it's the right thing or the wrong thing for you, but something that you might want to explore. Bariatric surgery for some people is maybe a very good solution. But simply getting out there, movement, enjoying, and develop resilience is important. You know, we've been all dealt with multiple blows, and there's more to come. But I'm also grateful that we live in a country that gives us good protection, good healthcare systems, and but we need to do our part. I learned the power of all vaccines. I think I've underappreciated being overweight. I've been overweight a good part of my life, and right now I'm doing something about that. My weight is drifting another 5 pounds in the wrong direction. I decided today I'm going to give myself a dose of Ozempic. I haven't been using Ozempic very often, but right now with the holiday season, right now I'm going to take a dose. For some people, you don't need it. For some people, you need it every week. And there's other avenues to that. I think activity is an important concept to all of us. Getting proper sleep, proper food, and eating properly makes sense. And the healthiest beverage right now is water. And I was just on a webinar yesterday about, is alcohol a serious problem in Ontario? Yeah, it is a serious problem. The consumption of alcohol has gone up by 40% since the start of the pandemic. Alcohol is not a health food. And so you can explore that on your own terms. But I'm very grateful that there's so much you can do. And what we're going to do is on January the 8th, I believe it is. Is that right?
Yep.
Is on the Sugar Hour. We're going to spend some time how to work over the next 30 months, 30 times, how to get that weight down. And for many of us, 30 pounds is something, that goal is within reason. It's going to take a lot of hard work and a lot of effort. If you have type 2 diabetes, less than 5 years, you have a 70% chance you can put into remission without the use of any medications for diabetes if you lose the 30 pounds and keep it off by 2 years. Most people have not been able to achieve that, but I'm confident that we can do it in a better way. And no longer acceptable for many of us right now to say it's, well, I don't have the time, I don't have the effort, I can't do it. I understand, but enjoy the journey. I enjoyed the Grey Cup. We came in second. The fact we were competitive was fantastic. The fact I had to spend some time with my son, who I haven't seen in a long time, was great. The fact I was in a stadium I hadn't been in 2 years was remarkable. And I feel you can be outside as much as you can be safe. Now, with this new strain coming, I don't know what to tell you for sure right now, but mass social distances, be smart, being around people that are properly vaccinated, having regular testing if you have any suspicion is a great idea. But one of my biggest pillars right now for all of you, if you want to have less cancer, less heart disease, better quality of life, less depression, less cancer, less congestive heart failure, then weight is a crucial factor. We have very effective therapy. People want to bypass or an angioplasty. I want you to have a good blood pressure, 110 to 120 systolic. I want you to have an LDL cholesterol less than 1. I want you to have a body mass index between 20 and 25. I want you to have adequate sleep. I want you to feel resilient, that you can save and help the world and help others. And I think we can all make strides in that direction. Some days I fail miserably, and some days I'm successful. And again, what makes me more successful is the people around. You see people like Jen, Stephanie, Rubina. These are people that are backbones to our team. From Trish to my wife. My kids suffer the most during this pandemic because it's hardest on younger people. We, as older people, can be more isolated. And so I learned a lot more by online learning than before. And I hope you take the time. And my wish for everybody is a safe new year. And for many of us, being down 20 or 30 pounds would be a safer way to being healthier. I hope everybody can start a new habit of spending 5 minutes every day to look at some of our webinars and get a little extra knowledge. And I guarantee you, if you had trouble sleeping, if you're on there for long enough, you will fall asleep. I usually fall asleep with my computer. In fact, I fell asleep a couple of days ago and I stretched my glasses. I have to do something about my glasses to keep falling off my face. But my computer was still in my hand. Somehow I did something to my glasses. So I wish all very a very happy and festive and safe holiday. We're grateful that we can contribute and we can make a difference. And I thank all these young people. Stuart, are there any questions?
No, not at this time. We did have someone just wishing everyone a happy holidays, and thank you to Adam and Nirme for putting together a fantastic webinar this evening.
And I thank you, Stuart, for all your hard work all the times. And any comments from anybody or thoughts from anybody? Well, I just want to wish everybody and that the pandemic is over in the next 30 days. I'm not sure it will be, but we can make ourselves healthier in the next 30 days so we can withstand the next wave. Keep up, everyone, and happy holidays.
Okay. Good night, everyone.